Good morning, children. In the previous classes, we have seen about our communication education technology unit number 8. We were seeing about the assessment. In the assessment, we have seen about the introduction of the assessment and also the types of the assessment also. So in the today's class, we will move on to some more methods of the assessment, that is some more methods of type of the assessment. So in our today's class, the outline of the today's class will be about the introduction of the assessment, the rating scales, which are the other different types of this rating scale, appraisal scale, what are the advantages and disadvantages, about the practical examination purpose, advantages, disadvantages, and about the objective structured clinical examination. Then also regarding the practical skill and how to organize the OSCE and what are the advantages and disadvantages also. Speaking to the objectives of the today's topic, it is to introduce about the topic, and the student will be able to explain and describe about the rating scale, types of the scale, appraisal scales, advantages and disadvantages also. And even the student will be able to explain and describe about how the practical examination is conducting and what are the purpose, what are the advantages and disadvantages also. And he will also or she will also explain about the objective structured clinical examination, its practical skills, what are the organization of the OSCE, advantages and disadvantages also. So you all know about the assessment. Assessment is nothing but we are focusing on an individual learner and the learning community class also. And the assessment, that is the assessment is a word which is derived from desire, means we are sitting with the children. So not much more taking this time. We will move on towards our main topic, that is a type of the assessment that we call it as a rating scale. So as the name is only indicating, what is rating scale now? Rating scale is the scale which is used to express the opinion or even the judgment regarding some performance of a person or an object or a situation or some character. Okay, a rating scale. What is this rating scale? It is nothing but a person is expressing his or her opinion or judgment in the form of either in the form of a person or in the form of a subject or a situation or a character also. Then the other meaning of this rating scale, it refers to the scale with a set of the opinion which describes varying degree of the dimensions of an attitude or a phenomena being observed. So what is rating scale? Rating scale is a type of a scale where what is there? There are a set of opinions, and in that set of opinions, the person is describing the various degree of the dimension about his attitude, what he is thinking about that particular statement. So that we call it as what? Rating scale, and either it could be a 3-point scale, 5-point scale, or even the 7-point scale. So here are certain examples of the types of the rating scale. That what are the various types of the rating scale? We are mainly having the three types of the rating scale. For the first one is the graphical rating scale. It means graphs are there shown, and through the graph we have to show that how much rate we can give the rate. Okay, that is through the graphical method of rating scale it is. So here you can see in the graph we are having a low quality and you are having a high quality. So if a product is being asked, and for example, let me tell you about a small example about the marketing strategies, okay, which are happening usually we see in the TVs and all. So quality assessment is being done. I think you have seen the example of advertisement of Dow. In this Dow advertisement, they will be showing, they will be taking one litmus paper and they will be testing for its acidity and all. Okay, so it means they want to show that that particular soap is a very good quality of soap and it won't give any reactions or acidicities to the skin. So it is a very low mild soap they want to show. Okay, so now we want to assess, there are various soaps available in the market. So we want to assess which type of soap we are going to use. Okay, so which kind of soap we are going to use, that means how we are using it, and we are quoting that one, how much efficacy it is. So in this graphic method of rating scale, what it will be there means we are finding how much quality the particular thing is, whether it is a high quality one, it is a low quality one. With the help of the graphic scale, we can assess it. For if it is a very good high quality, then we can mark in the high quality area, and if it is of low quality, then we can mark it in a low quality area. If it is in between, then we can mark it in the in between area. So this type of rating scale, we call it as a graphic rating scale. And when coming to the descriptive rating scale, so descriptive rating scale means you are describing regarding any particular person, or maybe an incident or anything as such. Okay, so here what we are what is the thing here, the description is going on. For example, here we are having certain scenarios like Ankit is there, Rajesh is there, Preeti is there, Shubha is there. So how much clinically well they are performing, so their level of clinical performance is being evaluated. So how we can evaluate them? We can say that that particular person is a very active person. No, he is non-active, means moderately active, or even you can say he is very only active, means active, or he is a moderately active or a passive person also. This type of the notifications, yeah, this type of credits we are giving to the particular candidate, and we are describing about his quality. Okay, so that type of rating scale, we call it as a descriptive rating scale. Then comes the numerical rating scale, similar to that of the graphical. This is also a numerical rating scale. Here we are putting, means we are grading the numbers, means how much quality it is, whether is it of a very good quality, or whether it is of a very bad quality, or even you can say, means the level of the pain, the level of even you are measuring it, how much at how much severity you are having. Okay, so if it is 0 means if you are having no pain. Okay, 1 means a little bit pain is there. Then if it is 10 means worst pain, we can say. So in this type we can rate the particular attitude, you may say, a particular performance of a person, or what the feeling the person is feeling. So he can rate it through the rating scales. Okay, so next comes the what is the common content of the appraisal in the rating scale? Usually, what common content we are using for the quality of the work? We are using means about the reliability and the accuracy is being used. For the volume of the work, which initiative, cooperative, this type of things we are using. And for quality of the work, judgment and ability and dependability, neatness and willingness. So you can see here means how we are measuring it. If nobody means no person is not at all hurting, means we can show in this emoji form 2 hertz, 2 hertz means 2 time he is hurting means little bit. Okay, 4 time hurting means little more bit, even more, and hurts very much, and hurts worst. So these are the various type of the content appraisal in the rating scale. So now coming to the what are the advantages and disadvantages of the rating scale. Rating scale are easy to administer, and they are even less time consuming also, and can be easily used for a larger group of the people. Okay, and these they are also used for the quantitative methods, and they are used to evaluate the performance and the skills and the product outcome also. Means we are, as already described, we are in the marketing field. This type of the rating scale method is being used in order to evaluate them. Means they are using for the evaluation purpose about how the performance is there, about the even the product outcomes also. This can be understood with the help of the rating skills. Next, what are the disadvantages? It may be difficult or dangerous to fix up a rating about many aspects of an individual. For many aspects of an individual, it may be little difficult or hard to fix the aspects also. And misuse can also result in the decreased objectivity. Misuse in the sense, many people may purposefully mark very wrongly also. Next comes the practical examination. You are also familiar with this type of the assessment. Every year in you will be having a practical examination. For example, in the first year you had the practical examination in your fundamentals. Okay, so practical examination is a concern with the assessment of the practical performance skills and the practice competency acquired by the students during the course of a particular program. So in this practical examination, what the assessment is being done? Assessment is being done especially to find the practical performance of the skills, and in order to practice the competency acquired by the student during that particular course, that we call it as a practical examination. Then what are the purpose of the practical examination? That is to assess the practical skills, to assess the development in the affective domain, then to assess the students' problem solving skills, and to assess the recording and reporting skills, to assess multiple performance tasks such as assessment, planning, implementation, and even the communication also. On this practical examination can be. Then what are the advantages and disadvantages? Speaking about the advantages, how the practical is helping, it will help to provide an opportunity for assessing the skills and the competency. Means the student can, with the help of the practical examination, we can assess how much the student's skills is there, how much the competitive level of the student is there, that we can assess. Next, it provide an opportunity to the examiner for assessing the use of the compartmentalized knowledge also. It will further help us to provide an opportunity to the examining, means we are assessing the use, how much compartmentalized knowledge is there. Next, an examiner also get an opportunity to assess the communication and interpersonal skills also. For the examiner, it is further helping to assess the how much the communication is there and how much interpersonal skills is there in the student. Next, when disadvantages, it is considered as an objective method of assessment, and it is also a time-consuming process. It is not feasible for a larger group of people, and sometimes it is considered as unethical to expose the patients for examining the students also. Next, coming up about the objective structured clinical examination, or we can call it as simply as OSCE. OSCE, it is a modern method of the examination for what? For assessing the clinical skill performance and the competency in the skills also. As such, the how about the communication, what about the clinical examination, even medical and nursing, what about the procedure, prescription, what is the exercise prescription, joint mobilization, techniques and interpretation of the results are being done in this objective structured clinical examination. Okay. Next, in this about the definition of the OSCE. What is OSCE? It is an assessment tool. It is having a components of the clinical. So, what clinical components it is having? That is the components like history taking, physical examination, simple procedure, may be there. Even interpretation of the lab results, patient management, communication, attitude. Okay, these all are tested using an one checklist is there, and the student is being rotating around the number of the stages, and there are observations with the checklist in that particular stage. So, objective structured clinical examination, the skills which are assessed during the OSCE are, means whenever we are doing the objective structured questionnaire clinical examination is going on. So, what are the practical skills to be kept in the mind? That is the interpersonal and communication skills, history taking skills, physical examination, mental health, clinical decision making and clinical problem solving, even the interpretation of the clinical findings, management of the clinical findings, management of the clinical situations, patient education, acting safely in an urgent clinical situation, and basic and advanced nursing care procedure practice. So these are the practical skills which are assessed in the nursing using the OSCE. Okay. So next, objective structured clinical examination, that is the OSCE. How we are organizing the OSCE now. So for the organization of the OSCE, firstly what we have to do, the OSCE means it is must have around 10 to 15 stations, and in each station the student has to spend around 4 to 5 minutes. And these number of the stations where the time the student is spending, okay, they may be varying based on the needs of the evaluations. And once the student has completed that station, then he will move towards the next station. That is, all stations should be capable of being completed in the same time. We have to plan such a way that all the 10 15 stations should be completed in that similar same time period only. Okay, and the students are rotated to all the stations and to have to move to the next station at the signal. Means there will be a bell, and after that bell, immediately the student has to move to the next station to perform that particular procedure. As the stations are temporary independent, student can start at any procedure station and complete at any cycle. So there are 10 to 15 stations. It is not that all the students will start from the first only. It is not that one. Anywhere the group of the students can be kept in any place. Okay. Then what we can do? We can rotate the student. So the student will be moving to the from one station to the next station after giving a bell. So here the student will be completing the cycle in the same way. Means wherever the student is starting, after the bell, they will go to the next station. Similarly, they will be rotating and they will be completing. So around approximate around 4 to 5 minutes will be spent in each station. The approximate 15 stations and 4 minutes each also means 15 students can complete the examination in 1 hour. Means one candidate will be there in 15 station and one student will be taking 4 minutes. Okay. Next, the how we are organizing. As I already told you, we are organizing in the station wise. So each station is designed to test a component of a clinical competence. So at sometimes stations called the procedure station. Okay. So these procedure stations, that is the students are given task to perform on the patients or the simulators at all the stations. There are observers which are agreed upon the checklist and the rating scale and to score the students' performances. So as I told that there are various stations and 15 stations are there. In each station there will be an observer, and that observer will be having that checklist and will be observing how the procedures or whatever the task which is being given to the students, are they performing it in a proper way or not. Okay. Then at other stations also called the response station, the students respond to the questions of the objective type or interpret the data or record their findings of the previous procedure stations. So this is a type of a objective structured clinical examination one. And coming to the advantages, it is more valid than the traditional approach to clinical examination, and examiner can decide in advance what is best to be tested also, and examiner can have a better control on the content, and this is more reliable, and the use of the checklist by the examiners is there. Then students knowledge and skills are tested in the compartments. Then demanding of both the examiners and patients is there, that is one of the disadvantage. And examiners are required to pay close attention to the students because repeating the same task will be also possible, and it may be difficult to maintain the uniformity also. So that's all about the assessment scales and the exercise for the today's class. We have to write about the rating scale, types of the scale, practical exam, and about the objective structured exam, clinical examination. Then these were the learning outcomes which we have achieved, and these are the student effective learning outcome, and then the references for this, that is KP Naraja, Suresh Sharma, and Neelam Kumar. That's all about today's class. And again, with the new type of assessment, that is evaluation, we'll see in our upcoming class. Okay. Thank you.